And finally, we'll have Danielle Yancey. We're excited to welcome her to the panel. She's the director of the Native American Center for Health Professions at the UW School of Medicine and Public Health. Thanks.
All right, Poso, good afternoon, everyone. Again, my name is Danielle, and thank you for inviting us to share a little bit about the work that we do at the School of Medicine and Public Health with our center. I think one of the advantages of going last today is that I think the rest of the panelists have really set some great context around the workforce development needs in healthcare, and then also with pathways programs, and particularly the need to connect with underrepresented students. And I think that's really where my presentation is going to focus on, what has our center done towards reaching out to the tribal communities and native populations in the state of Wisconsin. So for my presentation today, I want to first start out with just a general overview of our School of Medicine and Public Health, kind of highlight some of the programs that we have within our school that focuses on workforce development, and then also share some best practices in some of our services and resources through our program. So first off, our mission at the School of Medicine and Public Health is advancing health without compromise through service, scholarship, science, and social responsibility. And our mission at the Native American Center for Health Professions really embodies that mission as an extension of that work. So, our mission is to improve the recruitment and retention and graduation rates of Native American health professional students to promote health education, research, and community academic partnerships with Native American communities. Our center is relatively new, so we were established in 2012. We are supported in part by the School of Medicine and Public Health, but a few years after our center was started, we were fortunate enough to receive funding through the Indian Health Service through the Indians into Medicine grant. So InMed was really great in terms of bolstering our efforts towards healthcare, workforce development, and recruiting more Native American students. So, this $1 million 5-year grant allows us to really do more work under our 5 mission aims, which is to recruit, retain, and graduate students, to also develop Native faculty, and to recruit more Native faculty. We also focus a lot on improving our students' experiences when they are coming to the university and leaving their homes. And we also have a lot of focus on enhancing the curriculum and education experience of our students, so learning more about American Indian health, and then also supporting our tribal community partnerships. So at the School of Medicine and Public Health, we have an overall aim to optimize the health and well-being of Wisconsin communities. We also try to live out the spirit of the Wisconsin idea. So what we are doing here at our flagship university, taking that beyond the borders of our campus throughout the state of Wisconsin. So at the school, we do have a number of statewide campuses at Green Bay, La Crosse, Marshfield, and Milwaukee. And the map here that you see highlights where those campuses are located in addition to our clinical sites. What's really exciting about the work that's happening at the School of Medicine is that 75% of our incoming class are Wisconsin residents. So I think today we've been focusing on the healthcare workforce needs for our state. And so this is something we're really proud of at the school. We also have an aim in terms of the design of our education and training is that we want our students to stay in Wisconsin. We heard a lot about the needs and how can we facilitate those opportunities as students transition from training to practice. A couple of programs that I wanted to highlight under this presentation that really focuses on underserved communities as our efforts to address health equity in the state. So one program is the Wisconsin Academy for Rural Medicine, better known as WARM. So this program was started in 2007. They've graduated 126 students to date. And what I think is really profound about WARM is that of the 35 residency graduates to date, 91% of them are practicing in Wisconsin. So I think it reinforces a lot of what we've heard from the other panelists about making those intentional linkages. Our clinical rotation sites are at Marshfield, La Crosse, and Green Bay. Our center works very closely with WARM because many of our tribal communities are located in rural parts of the state. So we have had some of our students that have gone the WARM track. Another program is the Training in Urban Medicine and Public Health, better known as Triumph. So this program recruits and prepares medical students to serve people living in urban HIPSAs. What I think is really great about this program is with 52 students currently enrolled, approximately 1/3 of the Triumph alumni currently practice in Wisconsin. So again, making those linkages to meet the health care workforce needs of our state. NACHIP also partners very closely with Triumph. One little known fact about the Native population in Wisconsin is that Milwaukee has the largest Native population in the state. So they do have healthcare services in the Milwaukee based area. So we work very closely with their program as well. So, focusing a little bit more on NACHIP and the catalyst for our work, we heard a lot about HIPSs and how those are identified. When you look at the map on the right, it shows you where the tribal communities are located within Wisconsin. There are 12 Native nations in the state, and 95% of counties with tribal lands are HIPSs. So, this is a huge need within our tribal communities in the state. Um, and so I think was a major driving factor and presented a great opportunity of what we could do at our university to serve our tribal communities. Like many have mentioned, our programming really focuses on engaging with students early on, especially from our communities. A lot of our work focuses on relationship building because there's a shortage of health professionals in our communities. Don't readily have access to mentors or see health professionals from their backgrounds. So we are very intentional with engaging students early on. This graph here shows kind of our cycle of programming that is engaging with students at the middle and high school level with programs like the People Program. We have an annual Indigenous Health and Wellness Day that brings 80 to 100 youth to campus in the spring each year. And then the work that we are doing with students in their first years of undergraduate programming all the way through to their application to health professional programs. So many of our students are first generation college attendees, and the majority of them are also first generation for applying for health professional programs. So what our staff and our support and services allows us to provide advising and mentoring and technical assistance and support for students through that process. One of the programs that we work very closely with in our school is RUSH, which is Rural and Urban Scholars in Community Health. This is a 2-year program that, again, really has an intentional focus on rural and underserved urban areas of the state. And so the first summer experience is an 8-week research experience program, and then the second is a community health experience, which is also 8 weeks. So I think all of this illustrates is the importance of connecting students to health opportunities throughout this long pathway. I think many people talked about how healthcare doesn't immediately yield professionals, right? This is kind of a building process, and how do you keep students engaged and connected? We also offer a lot of support and resources for our students that attend our health professional schools. We work very closely with our admissions office. We also do a lot in terms of cultural programming. So for our students, research shows that students from tribal communities are 55 times more likely to return home to deliver care. So, as they are participating in their training programs, we think it's vitally important to incorporate cultural programming as part of their training experience. So, we do a community visits throughout the year that focuses on culturally congruent care, traditional foodways, and impacts on public health. So, this is an important part of our programming. Our grant also allows us to offer our students additional professional development opportunities. So there is a national organization called the Association of American Indian Physicians, and they do an annual conference and offer a cross-cultural workshop that focuses on traditional medicine. So these are really important opportunities for our students as part of their training. Another really exciting part of the program that we offer is we work closely with tribal communities and healthcare centers in the state so that we can open up tribal clinical rotations, internships, and experience. So, again, this is about creating those opportunities for students to train and learn within tribal communities, and I think supports the hope that they will return to these communities to deliver care after their programs are done. We also have a partnership with North Dakota State University. So they are the only Masters of Public Health program in the country that focuses only on American Indian health. So Dr. Donald Warren is the chair of that program. And so this we are able to support our students to access distance learning opportunities to learn more about American Indian health. And then lastly, we have a NACHIP Advisory Council. So mentorship is also a really important aspect of supporting students through their academic pathways. And so we have over 20 NACHIP Advisory Council members who are faculty affiliates of SNPH who provide mentorship to our students as they are pursuing their programs. Some additional training and education opportunities that we provide is we give a lot of classroom presentations. We invite faculty for luncheons. We also um, started a distinguished lecture series this year. So this is all a part of our efforts to incorporate more American Indian health topics for all students that are going through the health professional programs. Like I mentioned, here in the state of Wisconsin, we have 12 Native nations. So it's important that all future practitioners are learning about our communities. And like I mentioned, our partnerships with the clinics are also really important. So, what have we been able to accomplish, and how have we been able to move the needle in terms of increasing Native American health providers? This is a graphic that kind of shows our enrollment of American Indian students prior to the establishment of our center. In 2008 and 9, we only had one Native American student across all of our health professional programs. And as of 2017, we now have 23 students that are enrolled in our program. So we're really finding that with the complete package of what we can offer at our school is what is attracting our students to want to come and train and learn and eventually work in the state of Wisconsin, especially for those students who have an interest in American Indian health and practice. This is a breakdown by schools of the number of students that we have in the various programs. We not only work with the School of Medicine and Public Health with our MD, PA, PT, genetics counseling, and Masters of Public Health programs, but we also have a close partnership with the School of Nursing, especially with the recent award of the HRSA STREAM grant, which is really exciting. They have the goal of graduating 30 Native nurses over the next 4 years. We also work with the School of Vet Medicine, Social Work, and Pharmacy. So, challenges and opportunities, and I think we're seeing some trends amongst all of the panelists in terms of what the needs are. The high cost of education is definitely a barrier, especially for families who are low income, are first generation. That is an incredible amount of debt to think about incurring over time. So, loan forgiveness programs are really great. Increasing scholarships is another important mechanism. A lot of our students have accessed the Indian Health Service Scholarship Program, which I think is a really great opportunity because it not only helps students with their debt, but it also creates an intentional pathway for service in tribal communities following their graduation. Funding for educational programs like InMed is also incredibly important. So that early engagement and connection starts very early on, but we're seeing that it has a profound impact on students going into these careers. Graduate medical education, there's definitely a need for more opportunities there. Creating more residencies within the state of Wisconsin so we're not losing students is really important. And then increasing those clinical capacity limitations is another barrier. So how can we open up more opportunities for that? So I just wanted to share some resources because I went very quickly through what our center does, and there's always more to learn. But we do have a Facebook page where we post opportunities, research, and internship activities that are going on with our center. So that's a great way to follow us. This is also the link to our website. And We Are Healers is another really great digital mentoring tool that we use to engage with our youth. So I encourage you to check that out. And in your folders is a brochure that provides more information about our center. Well,